Today's podcast is being sponsored by a project that we at Power Monkey have been working on for a while and are incredibly excited about. If you've ever wanted to attend Power Monkey Camp with some of the world's best athletes and coaches, here is your chance. On January 1st, we're bringing Power Monkey Camp to your living room with Power Monkey Camp Online. Online campers have access to over 22 hours of station lectures featuring our elite coaching roster of Olympians, national champions, world record holders in their respective fields. This course is for everyone, beginners, seasoned athletes, coaches, and even fitness enthusiasts. We're offering you an incredible opportunity to learn from some of the top coaches in gymnastics, Olympic weightlifting, aerobic capacity, rowing, jump rope, kettlebell training, as well as doing some lectures on programming methodologies, nutrition, injury prevention, and even on mindset training. Additionally, Power Monkey Camp Online will provide continuing education credits for NASM, AFAA, CrossFit, and others, and serve as your first step in becoming a Power Monkey Fitness Master Trainer. Registration is open now, but will close at the end of February. Go to academy.powermonkeyfitness.com to find out more. Hey everyone, welcome to another Power Monkey podcast. On today's episode, Chad and I interview Dr. Jaime Schehr. Jaime is a former guest of ours and a huge part of our Power Monkey family. It was great to hear from Jaime again after not having her on for a few months to talk about a little bit what the last few months have looked like for her, not being able to hold her practice in New York City in person, doing a lot more things remotely, and talk a little bit about some topics dietarily that are on people's minds right now. What supplements are really beneficial to take during COVID times? What are some other things that we might be coming in contact with, especially during the holidays, with what eating habits look like? And she's just a wealth of information and knowledge and is straightforward. She's an incredible person, and we're excited to have her back on the show. Hope you guys enjoy it. Okay, back with another episode with Dr. Jaime Schehr, who was on previously, kind of right the start of when pandemic hit. Jaime, welcome back. How are you doing?
Thank you. Thanks for having me again. This was an unexpected surprise, and I'm very excited to be here. So
Of course.
I'm well. I think I'm like the rest of the country, just sort of, going with the flow and seeing what's going on and trying to pivot and adapt and create a new sense of normal.
Right, and obviously, two young girls at home, running business. You have multiple businesses between you and your husband. Extra challenging this time of year with everything going on. Your daughter's been home, not in school and things like that.
Yeah, I mean, I think it's extra challenging for everybody in their own right. Even when I talk to people who might be, single and not having responsibilities similar to mine, it's challenging for them in their own way, right? Like they can't go out and meet people and they're alone. And so it's been interesting to pay attention to what my struggles and my challenges have been, and then to be empathetic towards the idea that what an unprecedented time. So who's not going through challenges? However, yeah, the kids working from home, the other day I was working from home and my daughter comes in. I'm like, Lana, I'm on a call, and right, my visits are virtual. So like the person is seeing all this. She's like, yeah, but I'm bored. That's not my problem right now. So I think it's challenging across the board. But yeah, I mean, I don't know what to say other than we learn to change and adapt. I think the biggest lesson for me is that I never thought I could have prior to needing to have, right? Like if someone said to me last year at this time, you're going to give up your New York City office, you're going to work from home, your children are going to be home at the same time that you're working, I'd be like, that's the funniest thing I've ever heard.
Yeah.
And here we are.
Well, one of the things that came out of it, you guys opened up a new studio, right? You opened up a new chiropractic studio for Isaiah and for yourself, and it's beautiful. And you guys spend a lot of time there. I mean, I love seeing your videos where you're working out. You have a set of rings there. You have a climbing wall. It seems like it's like a perfect place to hang out and get some sessions.
It's the perfect place, or it's his man cave. I haven't decided yet. It's like his dream come true, but it's not in the house. So maybe that's even a plus. I'm not sure. Yeah, when this all hit, obviously with you guys and with some of the stuff that we've done, we worked with traveling a lot and doing testing all over the place. And Isaiah had often for a long time been looking at trying to change the landscape of his own practice. So when the pandemic hit and we were all forced to look at what the next 6 to 12 months would look like, for him, it was an opportunity to say, well, I don't want it to look like it used to. I want to take this as a chance to change. And so sort of just decided to take a leap of faith, get a space, fill it with our favorite equipment and the best of the best things, and open it up as FitLab sort of headquarters and just have a chance to really do things there. So I feel a little spoiled because gyms are closed, right? So like I feel a little bit fortunate / lucky / whatever to have a space where I can like, get on my treadmill kind of thing. So yeah, it's
Absolutely.
exciting.
And Chad, I don't know if you've seen it, but it's predominantly gymnastics-based equipment. So just so you
Sure,
know that the
sure.
gym there is
Yeah, I
correctly set
appreciate
up.
that. I appreciate that jab there. I
Oh,
get
don't
plenty of
worry.
these
There's a
on this
rig.
podcast.
There's a rig and there's some weights. There's
Oh, I haven't
definitely.
seen that.
Yeah, I do remember Isaiah reaching out and asking about that. But I love how he snuck all this in, and it sounds like he almost made you believe it was at least partially your idea.
Oh, for sure. I mean, that's marriage, right?
Yeah.
We learn how to
Well,
speak a language that makes the other person on board.
I need to take some notes for sure. He did a great job there.
So one of the things, Jamie, that I've noticed recently, probably going back to the start of the pandemic, is the way you started to format your social media, your Instagram. And I think it's awesome. And it's a really digestible way to get through concepts and topics that can sometimes be overwhelming for a lot of people. And I want to just pick a few of the topics that you've touched on in the past few months and dive a little deeper into a few of them, especially ones that have come up a little bit more recently with COVID and things like that. Are you up for that?
Let's do it.
All right. So one of the ones is vitamin D. And we talked about this a little bit maybe on your last time you were on here, but vitamin D has been kind of back and forth with regards to its effectiveness and being helpful with COVID, along with some others, along with maybe vitamin C and zinc and some other immunity boosting supplements, things like that. I want to just get your take on specifically vitamin D, the benefits of it, and then whether or not you're on board with it being helpful for things like COVID.
Yeah. So, I mean, vitamin D prior to COVID was really catching a lot of attention and popularity for all of the roles that it plays in our health. And then I think, whether we're able to say it's causation or correlation, when we look at the studies of COVID outcomes, we're seeing that there is a connection to worse effects or exacerbated cases in people who have a vitamin D deficiency versus those who have normal vitamin D levels and their experience with the virus. Nobody at this point yet can say that it was the D deficiency that made it worse or it's just connected to, but it sort of opened our eyes to the idea that optimizing your vitamin D status is potentially a very important move in your immune attempt or your immune fight against this virus that we're all dealing with. Everything we know about COVID is new, right? There's no, evidence-based clinical trials or studies that are years old as some of our others are, or years long, I should say. So everything I say is sort of with the idea that this is what we're looking at right now, and it could change, but the vitamin D argument is really interesting because we do know it's connected to immune function, and vitamin D is depleted in inflammatory conditions. Well, what we know about COVID and the people who have the more negative outcomes of it, they tend to have something called a cytokine storm. They have an inflammatory cascade that makes them more ill than other people. So we know that there's a very large connection between inflammation and the challenges within this virus. So by that means alone, if we know that vitamin D stores are lower in people with inflammatory conditions, and then those individuals are potentially dealing with something like COVID, which has its own effect on inflammation, you put that together, it really stands to need to look at how do we make sure that we're at least accounting for this particular nutrient that's so important in hormones and inflammation. So yes, I'm on board. I do think that like anything in nutrition and health and wellness, people just tend to take it too far. And it's not a good idea to do that, right? So there's people that'll say, I'm taking 10,000 IUs every day. And I'm like, well, that's actually not necessarily productive if we don't know what your levels are. But taking 2,000 IUs a day for, November through April is arguably a good idea for everybody because it's immune support. It's going to help manage vitamin D levels. Different, of course, for people that have had deficiencies. But if it's you or me, we're just sitting here like, would you take vitamin D? Absolutely, I would take it. And I do recommend that people take it daily at this time. I've been really fortunate to be asked to be on part of a board for Mount Sinai Integrative Medicine to look at all of these really integrative and alternative ways that we can manage or address COVID. And vitamin D, from conventional standpoint and integrative standpoint, is probably the top of our list.
That's really great to hear. And, you've been having me take vitamin D for a while now, and, living in Portland now where the sun does not shine nearly as much in some other locations, it's obviously been something that I've been a little bit more proactive about. But you mentioned it in terms of just a recommended daily amount, and being that 2,000 IUs. Is that the amount that you would recommend for just daily usage, just to kind of cover yourself?
No, that would probably be closer to 1,000.
Okay.
I throw the 2,000 around when we're talking about pandemic, COVID, immune support, increasing vitamin D status. So 1,000 is what we sort of say to people, like, that's a good daily dose of vitamin D. And then when we bring the conversation in around, okay, but now we want to look at it as like a little bit more of immune support. We're looking at it for, obviously in the connection to what's happening with the pandemic. That's when we're sort of recommending the 2,000, and it's not forever. I'm saying November, December, January, February, we'll recheck levels. I tell everybody to have their vitamin D levels checked once a year at least. I understand that if somebody doesn't have health insurance, it's a little bit more challenging because it's an expensive test. But I would argue to every single human that has the ability to have a lab test that checking your D once a year is very beneficial.
That's really good to know. Now, all of these other things that kind of combine to boost immunity, vitamin C, zinc, curcumin, are they kind of as important? Are they on the list as well for you when you're suggesting things to people, or is it kind of dependent on the person?
So vitamin D is like the daily, right? That's sort of something, sick or not sick, because people just incorporate into their health, their daily supplemental routine. Something like zinc, vitamin C, curcumin, elderberry, we can think of those more in the presence or in the connection to you're around somebody that's sick, you're exposed to the virus, or maybe not even known exposure, but you're around more people. If you're have a challenge in your immune system, I don't mean disease-wise, but like if you feel like there's an opportunity for you to get more sick than normal, then those things are helpful. And if you do feel like, oh my gosh, I feel a little under the weather, I feel like I have the sniffles coming on, yeah, we go a little bit harder with with vitamin C, with zinc, with curcumin. Elderberry has some phenomenal research, but it actually is all at the sort of transmission of the virus and not necessarily once you have it. So there's a few nuances in this sort of supplement protocol, but if I had to give you 5, it would be vitamin D, it would be zinc, it would be vitamin C, elderberry, and curcumin. Okay. And curcumin goes back to that whole anti-inflammatory perspective, and how we're looking at COVID being really inflammatory, which is now why we understand the connection to cardiovascular and metabolic risk factors.
Yeah, that all makes sense to me. Now, I'm just going to rant on this for 1 second. I want to get your take on it, because I know as much as you look at things from the integrative medicine side, you also have the perspective of the fitness side of things, and the importance of actually being aware of boosting your immunity through a fit lifestyle, sleep, diet, as well as your actual fitness levels. I don't hear that kind of stuff being talked about nearly enough, in terms of how much sleep are you getting, this actually affects it, how much alcohol are you drinking, this affects it. Are you working out on a regular basis through all of this, rather than just sitting a sedentary lifestyle because you have to be at home? How important to you is it to have all of those things you talked about in terms of supplements and vitamins, in combination with some kind of fitness on a daily basis, to actually say that we're tackling something like COVID from all directions, rather than just saying, stay home, wear a mask, stay away from people, and don't worry about those other things. Those things will be secondary.
There is no of those things if you don't do the fundamental things first, right? Like if you are not eating well, if you're not exercising regularly, if you're not sleeping, none of that other stuff has the effect and the benefit that it can have if you don't create a foundation for it, right? So it always goes back to setting yourself up to be able to fight, setting yourself up to be able to, take on something like a virus. And so wellness is essential. But here's the problem. You know the saying sex sells, right? They're like, they'll throw something, they'll say sex sells because there's sort of this idea of images. And it's the same thing with supplements. Like, people don't want to hear, oh, you have to exercise every day. You have to eat well. You've got to sleep. You've got to meditate. Media, marketing, and us as individuals, we look for like, what can I do? What can I take? What can you give me? What is, it's a default of all of us to look to the idea that there's something we can get or we can take or we can have that's going to fix this. Because it's a lot easier to do that than to say, have I meditated? Have I exercised? Am I eating well? Am I sleeping? So it goes back to everything in life when we look at, like, we'll go to a doctor to get sleep meds, but we haven't turned our phone off before we've gone to bed. We haven't stopped watching things that are stimulating. We haven't stopped having coffee at 5 p.m. So like, and then it just sort of gets into this, like, you can't get off the carousel. So when it comes to what you're talking about, like the idea that fitness, diet, sleep, stress management come next or come after, or even on the same playing field as supplements is absolutely untrue.
Well, I agree with you completely. I want people to really understand, I mean, your perspective, my perspective, I'm sure Chad's on the same page with just the world that we come from. Just the conversation about fitness and a fit lifestyle has been advantageous for people that have been in contact with COVID. If you have a background where you've been working out regularly and been conscious about your sleep and your diet, you're actually in a much better place to be able to handle this. And I think that that's something that needs to be discussed, as much as make sure that you're conscious of wearing masks in public and limit your interactions and all those other things. Let's also understand that the life that you lead in terms of how healthy you are gives you the best chance to be able to kind of work through this. And I think it's just such an important piece that I think sometimes is glossed over.
Well, yeah, I mean, change is hard,
Yeah.
for all of us as adults, like, to feel like we need to do something that is that monumental, even though we sitting here on this call know it's not. It's it can be a very small change, but feeling like, oh my gosh, I have to change my lifestyle is so challenging. I was on the phone with a woman the other day, and she was adamant that she had no time to exercise. And in her intake form, I have a super long intake form, she marked watching television for 2 hours a day. She marked stress being like her everyday, like laundry and, all of these different things that she had. So when I asked her about exercise, she's like, I don't have time. And I mean, if you've heard me before, I'm pretty direct of a human. I just sort of sat there with her and I said, actually, it's not true. You don't prioritize it, and that's okay. So that's not me insulting you. That's not me like pointing the finger at you doing something bad, but let's call it what it is, because you can't change it if you don't acknowledge it first, right? And I think it goes back to all of these things that we struggle to change, myself included. I know I need to meditate. I tell you I'm a bad meditator. I can't do it. I don't make time for it, all of those things. But yeah, I mean, why aren't we talking about fitness and nutrition and sleep and stress management? Sadly, because it's not going to get as many likes or as clicks or as many, like, people are really looking for something they can grab.
Right.
Yeah, harder for any of us to make any kind of change at this point in my life. It's harder for me not to work out, and I think that all of us can agree on that as well. Like, if I just told myself, okay, you know what, you can't work out for 4 weeks or something like that, I would be devastated. I would not be able to do it. So it's just a matter of what we make routine, and watching, you said that girl marked down watching TV for 2 hours. That in her mind is something that is part of her routine. It's what probably she feels like it helps her wind down or something like that. So that would be hard for her to change, and it makes perfect sense. I wanted to take us back, and I know we've kind of gotten off this topic already, but I had a few questions on a few of the supplements that you talked about that I wanted to ask you. And elderberry specifically, we talked about that last time you were on the recording, and I actually went and got some and started taking it. But you mentioned that it's more so for someone to take before exposure, meaning that if you get it, I'm guessing that you mean if you get corona, you don't necessarily need to go out and get elderberry. Maybe it's not going to do anything for you at that point. But what specifically does it do for you before exposure? Or if you're taking it and it's built up in your system and you are exposed, is it going to help keep you from getting it?
Yeah. So the research looks at elderberry as a potent antiviral in the, what's the best way I can describe it? Sort of in the replication or the attachment of the virus to the cells in our body. And therefore, once you have COVID, the research says that elderberry is not helpful in decreasing the duration of the virus or helping with the fight against the virus. But elderberry is potentially strong in when the virus is in the presence of particular cells in our body, preventing, I'll use the word adhesion, for the virus to attach onto the cells. So the way that we look at elderberry is prevention versus treatment or management. So for example, actually I have it right here in my cup. I give my daughters elderberry every morning when they're going to school because they are in a hybrid model. So there's only like 7 kids, but still that's 7 humans. And I don't know where those 7 humans were, right? So, or if Isaiah's going into the office, like we'll use elderberry on a regular basis in this particular time to hopefully prevent or support the idea that our body can fight off the virus before we would get sick from it. If, gosh forbid, one of us gets COVID, that wouldn't stay on my list. It would be much higher in other supplements that we haven't spoken about. So what we're talking about, C, D, elderberry, curcumin, those are more like really support the immune system. The ones that we're looking at when people actually have COVID, it's a different set of supplements. That's glutathione, alpha lipoic acid. I mean, we're looking at different things there to, at that point, try and prevent the virus from creating devastating changes.
I'm fascinated by all that, and I don't know that we can dig in and talk about all those. I wish we could, because I'm very, very interested. I used to work at GNC for on and off for I think 3 years. So at that point, I was like just in heaven, because what I did whenever I wasn't checking people out is I would read through this book of supplements that told me all about them and what all of them did and everything else, and I became a better, more informed salesman, but also got to fulfill my curiosity as well. But going to D, you talked about everyone should get an assessment on their D level, right? How would you recommend people do that? Just go to their general doctor? Is there anything at this point in time where people can do something like that online?
Oh, absolutely. I'm hard pressed to find anything you can't do online these days, especially after
right.
the pandemic has showed us all that we're so capable from our own homes. Yes, I mean, of course, your primary care physician or any of your physicians can order a vitamin D, but there's so many companies like Thorne, for example, and I have no affiliation. I don't work with them or anything. They have an at-home vitamin D test. You go on, I think you pay $190, something like that. They send you the kit. It's a finger prick. So you can put your finger onto the card, and then they'll tell you your vitamin D status, 4 weeks later. And they're all fairly accurate. And these are not the type of things that we need like such fine acuity. Like it doesn't have to be exact, but it's going to give you, what your vitamin D levels are. I know there's a number of companies that do it. I know Thorne just went public in not needing any provider on board in order to be able to order it. So anybody can just go online and order it. There's lots of companies that do that, but that's a great way to do it. If you have health insurance, insurance covers it most of the time to get tested once a year. So people like to do that from their doctor. But yeah, there's absolutely different ways to do it.
Awesome. It sounds like maybe, Jamie, you should invent a watch that will read your vitamin D level at all times.
I am pretty certain that somebody's working on it.
I would assume so. Yes. If not, then they should be. Maybe we should come together and develop that, and we can all become millionaires. I don't know, but can we talk just at least briefly about what you mentioned, supplements after you've tested positive, and what specifically, just kind of as a whole, those are trying to accomplish?
Yeah, I'll keep it really superficial because it gets a little bit dicey and confusing. One of the things that we're looking at with COVID is that it manifests itself very differently for different people. And that's a challenge, right? When a virus or an illness creates different sets of symptoms for different people, it makes it much harder for us to know how to address it. So You'll hear of people that lose their smell and their taste. You'll hear of people who don't even know they have it and they had it. You'll hear of people who had no smell and taste issues, but they couldn't breathe. Like there's just so many ways that we're hearing about it. So it gets a little dicey to talk through the supplemental stuff, because something like glutathione may be better for somebody who's experiencing more of the respiratory like effects, whereas something like alpha lipoic acid may be better for somebody who's having more of the smell and taste issues. So, I think an anti-inflammatory in the form of curcumin and vitamin D are important. I think vitamin C as an antioxidant, even, in the presence of illnesses, is really important. And then when you sort of get more specific, it depends on how the person is showing up with symptoms and where they are in the course of their illness. This is not at all in the context of integrative, but I find it fascinating. And now you've got me chatting. So I was at with a pulmonologist recently, and what they were looking at was the idea of inhaled corticosteroids, asthma meds, even for people who don't have asthma, but who have COVID, because that anti-inflammatory to the lung stops the progression of the disease causing the destruction to the lung, right? By no means is this me saying people should take an asthma pump. That is not what I'm saying. But what I'm saying is it's really fascinating that we're looking at specific ways that the virus is affecting people, and then thinking about different things that we would do for those individuals.
Yeah, it's going to be, I'm just interested to see what's going to happen in the next 6 months, the next year. Hopefully, in another year, this will be a little bit more past us, but who knows at this point, right?
I know. I just said this to Isaiah last night. I was like, how are they doing the Olympics this summer? Like, is there no spectators? Like, and it's, who knows? Because we don't know what it looks like. It's everybody's in sort of this pattern of not really knowing.
Yeah, they had actually their first international gymnastics competition in Tokyo a couple of weeks ago as they normally do an Olympic test event for all the sports, kind of like test out the facilities and make sure everything's running correctly. And they did the first gymnastics competition a couple of weeks ago, and it went off okay. There were spectators in the stands, and
wow.
Yeah, so it wasn't full capacity, but it looked like they're starting to figure out ways to at least host certain events. I don't know, Olympics obviously much bigger scale, but encouraging that those things could possibly happen. Want to jump to the next topic?
Let's do it.
Sugar. Because I think sugar falls into the same kind of category during pandemic. Seems like you need things that make you happy as much as possible. And, sugar comes in so many different forms, and some are much healthier than others. You have so many different takes on whether or not sugar in its different forms is at all good for you. It's probably one of the things that most people will say across the board, sugar is something you should not have in your diet. But I'm curious kind of to hear your take on the various types of sugar, and in what cases maybe some is okay, and kind of take it from there.
Yeah. I have this really strong statement that I live by, and I encourage all of my clients to as well, which is, it is what we do most days that matters. It's not what we do one day. And that's important when we're talking about sugar, because I'll get people who will say like, oh my God, I don't know what to do. It's my birthday. And I'm like, well, eat the cake, right? Or they'll say like, there's so many cookies on Christmas Day. Eat a cookie. Because it's when we don't have what is celebratory and normal and connection and important, we sort of deprive. And what happens to what's the opposite of deprivation? It's sort of letting go and not being able to control it. And then I see all these people sort of pendulum swinging, like, I don't eat any sugar, none at all. And then I'll talk to them 2 months later and they're like, oh my God, I'm totally off the wagon. I'm having, sugar every day. And I think what happens is when we don't create a space that feels like I can do this in a manner that's healthy and controlled and enjoyable, but not reckless, if you will. It's the same with alcohol. We can talk about it in that context as well. But it allows us to be able to experience the food as it is. So let's just say it out, like the way that we know sugar is addictive. It has drug-like properties. It affects neurotransmitters of the brain. The more sugar we have, the more sugar we want. There's tons and tons of science behind that. But that doesn't mean that if you ate a piece of dark chocolate tonight, you're going to fall off the wagon and be eating, gummy bears for the next 27 days. But people sort of get stuck in this, like, if I can't have any of it. And I'm really working hard to try and undo that process, because it's sort of the same thing of like, when you'll meet people who will work out 7 days a week, 4 weeks out of the month, and then like they'll never have a rest day. And you're like, well, why don't, like, if I have a rest day, then I'm going to fall off the wagon. It's that extreme perspective that doesn't allow us to be healthy. It doesn't allow us to listen to our body. It doesn't allow us to think about what we actually want versus what we need versus hunger versus boredom. So if you're somebody who's constantly looking to sugar, and you're just, you need sugar all the time. You're the one, I have to have gummy bears with my workout because I need sugar to get through. Like, we got to do some work there. It is very inflammatory. It is very problematic in health, metabolism, fitness, immune system. If you're somebody who's drinking soda and tons of sugars, like, we've got to do better. But if you're somebody who has, a little bit of sugar every day, or something that sort of ends your day, like dark chocolate, I don't know. I'm really in the camp of like, we can't be perfect. There's no such thing. These extremes are destroying us. And extremes are really prevalent in fitness, because people get so tunnel vision on like what they want to look like or how they want to feel, that they forget to feel. And then they wind up in a position where we're in an even worse shape, because it's just back and forth. So that's sort of my global perspective on sugar. But then not all sugar is created equal. You eating a gummy bear is very different than somebody eating an apple or strawberries or berries or dark chocolate. But yet people will do the same thing. It's like, well, I don't need any sugar, so I cut all the fruit out. I'm like, goodness, you cut all the fruit out of your diet just because you don't want to eat sugar, right? And therefore it's like, what's the saying? Cut your nose off and spite of your face, something like that. Like, you're getting rid of so much benefit because there's this fear, and it's a little bit unfounded. Should you eat a bowl of fruit salad with 4 different fruits and 7 servings all at once? Maybe not, but that's very different than, like, again, have a cup of berries or an apple with some nut butter. Goes back to this sort of, what do we need? What do we want? What are we using it for? Are you hungry? Are you bored? Are you looking to nurture a pain that you're not actually feeling? Or do you actually need the sugar because you just did a really hard workout? And remember, this is one of our electrolytes. Like, our body needs glucose. It's not made up. It's very, so this idea that carbs and sugars, they're always bad, you got to get rid of them, is just not necessarily true. And then I'll meet the people, and I'm sure that a lot of your listeners are going to sort of chuckle when they hear this, because they know they're that person. I don't need any carbs. I don't need any fruit. But then they drink alcohol most nights. But like, they'll cut out, they'll no pasta with dinner, no rice, no carbs, and then they'll have 2 or 3 glasses of wine. And you're like, so, I think it sort of goes back to the perspective of, how do we take the best care of ourselves? In my book, it's 80-20. 80% of the time, you have to be really responsible. You have to be an adult. You have to pay attention to the things that make us healthy and well. And 20% of the time, we get to say, I'm also human. And sugar is part of foods that are celebratory, and foods that are delicious, and foods that are social and cultural. So it's a tough one. I will say I have one hard fast rule, which people can argue me, I don't really care. Fake sugars are worse than sugar. I stand by it across the board. You are not doing yourself any benefit to an equal or a sweet and low or any sort of erythritol, aspartame, sucralose. What we look at and how they affect the gut bacteria, and therefore your overall health, is more problematic than a small amount of sugar. Then the next question is, well, what about stevia? What about monk fruit? What about all of these other non-artificial but not sugar sweeteners? I think if you are going to put energy into something, it should be into figuring out how less is more. Like, how do you eat the fruit or eat a little bit of the cake and not need to pour all of those other things in?
Mm-hmm. Yeah, so it seems like the route here and your perspective on it falls in line with just dieting in general. Like, moderation, understand why you're gravitating towards a particular, sugar or alcohol, and instead of just turning away completely from something, just understand that if you want it, moderation, 80-20, have it when there's a celebratory situation for it, as opposed to going so far in one direction that clearly the pendulum's going to swing back and you're going to fall off the cliff at some other point. That's why I just kind of like hate the idea of dieting in general, because it has a definitive endpoint when you're dieting. Once I reach that goal, it's over and I can go back to doing whatever I was doing before. Like, diet to me is that same thing. It just doesn't make sense. Like, it's a lifestyle that you're trying to achieve that you can actually implement and it work for you. So it seemed the same thing as with sugar.
When people ask me that all the time about things like, well, how do you feel about intermittent fasting? And I'll be like, well, it's a lifestyle. It's not necessarily a diet. It's not telling you exactly what to eat and when to eat it. It's more of a lifestyle, but is it the right lifestyle for you? If you're drawn to it because somebody on Instagram just said they lost 12 pounds from it, you're not that person.
Right.
So I don't know if it's the right thing for you. And we often, I say we as a community of people that I get to work with, think about what other people are doing more than we think about what we're doing ourselves.
Right.
And it blows my mind. I'm like, wait, you've had all this time and attention paying attention to what everyone else is doing, and you forgot to check in with what you're doing. And so it goes back to the dieting perspective of like, diet is money. Diet is marketing. Diet is I think it's a $2 billion business last year was diets and supplements.
I mean, it's not surprising at all. I mean, considering it's such a huge part of every day that we're, whether in the media or like social media, wherever we are, it's such a big part of every day for us. Along the same lines, I had a similar question. I have a feeling I know already the answer, but with regards to so many different dietary fads that kind of come and go, some last longer than others, whether it's vegan or carnivore diet, which seems to be getting a little bit more press lately, or like you talked about intermittent fasting or vegetarian, pescatarian, vegan, all of these different things. Are there any that you recommend? Do you think it is dependent on the person? Are there any that you say, absolutely not, this one just completely does not work? Or is it, again, to say, test it out for you individually. Some of it is environmental. Some of it is your own particular genetics that respond better to this particular type of, dietary option. But I'm curious what your take are with like all of these options as to whether or not some are actually not valid, some are more valid than others.
Everything is based off of some truth. It's just whether or not there's an entirety of truth. Every diet plan, every diet book, there's a thread of truth in there. It's just, where did they take that truth to, right? Keto was a very effective diet for seizure disorders and also for metabolic diseases. So we took that and we ran wild with it. And we said, well, you can lose weight if you're on keto. There's a thread of truth there. But then what's not spoken about are all the other things that come along with it. And so is it worth it? Or the carnivore diet, which I was just reading about the other day. Literally, you eat no plants, none at all, none, which blows my mind. Because there's this idea that plants have something called lectins, and lectins are toxins to the body. And if you put these toxins in, you're going to be unwell. Is there a thread of truth to that concept? Sure, but it's wildly taken out of context. So now we're dealing with like, well, that's not true when you put it into the situation of a human where we're living today. This is not Paleolithic times. So I don't think that any of these diets are completely off the table. They all do the same thing. They all try to create change for somebody so that they can feel different than how they currently feel. And so we're all looking for that when we're searching for, losing weight, getting more fit, whatever it is. What do I think is the best one? I say this all the time. I'm biased I live my life in sort of, there's no absolutes. So for me, a Mediterranean diet is the least of the absolute, right? You've got wine, you've got cheese, you've got fish, it's got grains, it's got dark chocolate, it's got berries. I think it's a great diet. I think it's very, very well studied. Someone said you have to give an answer. What is the best diet? Of course, the first answer would always be the best diet is the one that works for your body. But if I have to give you an answer, it's Mediterranean.
Okay, fair enough. I think I adhere to a lot of those Mediterranean techniques. What kind of diet are you on, Chad? Do you have anything that you kind of stick to?
I mean, I have a lot of beer in my diet, which is why I wanted to go back. I wanted to go back and talk about alcohol for a minute if we could, because I've had this question that I've pondered for many years, and I have what I feel is the answer and what I hope you'll say but I know you'll tell me the truth. Um, would it be is it worse for someone to drink 2 sodas a day or 2 beers a day?
Wow. Chad, I've been in practice for a long time. Nobody's ever asked that.
Oh, I've been dwelling on that for many years.
I'm going to go
And
with
I
worse to
answer
drink
it, yeah.
soda.
Hey,
I'm going to
you
go
Yeah,
just
worse.
thank
made
you very
Chad's
much.
whole year.
Now, listen,
Oh yeah,
obviously, like, if somebody has an issue with alcohol and blah, 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 that's different. But like, yeah, I'm going to go soda's worse because it's way more concentrated in sugar. And the type of sugar that they use in soda, meaning a high fructose corn syrup, is arguably the worst and most destructive, not even food, chemical that we could potentially put in our body. Beer comes from wheat. So nowadays you can get it without coming from wheat. Yes, it's calorically dense, but less than a soda and with way less sugar. I'm going beer.
love it. I love
Chad,
it.
success.
I know I can't get anyone to answer weightlifting on the other question, so at least I got that going for me. But taking that a little bit further, you talked about people earlier that would cut sugar out of their diet. They eat no sugar, they eat no fruit, they eat no nothing, but yet they have wine at night. I'm similar. I do eat fruit, but I eat very little sugar. Other than that, I really just don't necessarily. I mean, I don't even like how sweet it is. I mean, I guess my taste buds are just to that point. But I do regularly have 2 beers every night. So, what is the effect of that on me and on other people that do something similar?
Arguably there's not a negative effect because you're also somebody who is exercising regularly, paying attention to the foods that you eat, being mindful of living a healthy lifestyle. And it goes back to that 80-20. 80% of your day is rooted in wellness and health, and 20% of it is something that feels more comforting and enjoyable to you. So unless you had specific medical issues or weight issues or sleep issues, I might say that it's not having a negative effect on you. Could I say, over 50 years and the telomere length and alcohol and brain function, I'm sure anybody could correlate the idea that that wouldn't be good. But if you're asking me on a day-to-day, like what's the negative consequence of my 2 beers? I'd say if you're eating them with a healthy diet, you're exercising regularly and you're doing all those other things, then maybe there's not. Maybe there isn't a negative. Maybe we don't always have to find the negative. Now, if you are experiencing, insomnia or weight issues or fatigue issues, well, then yeah, I would challenge you to take it out and see if you feel any different. But otherwise, I don't know that there has to be a negative.
Well, I appreciate that as well. I'll take that as another win. And thank you for justifying my 2 beers a night. I really appreciate that.
You got it.
I want to jump onto one more before we start, and it just falls on the other side of the spectrum, salt. And I want to talk about salt because I kind of have more of an affinity for salt than I do sugar. Sadie likes to remind me that I have a tendency to put extra salt on things, and I'm more of the person that makes food in the house, and I have a tendency to put that into all the food that we have. But obviously there are some benefits of salt. It's much needed for a lot of the regulation that happens within the body, but curious what your thoughts are in terms of what role salt plays in diet and where you're seeing the negatives with regards to it.
I almost feel salt is in the same ballpark as sugar as far as like sources of it. I think salt is crucial in our diet. As athletes, you want to tank quickly, take the salt out, right? Like sodium is so crucial to energy, to cell function, to cardiovascular function. Like, I think people are too obsessed with salt because we did a really good job in the 80s of saying it was bad for your heart and for blood pressure. And what we're looking at now is that's not actually true. It's not salt, it's specific types of salt. So or you're cooking with a Himalayan sea salt, or you're cooking with, some fantastic salt that's going to bring out the flavor of your vegetables and really enhance things, and you're working out and you're hydrated, why would that salt be a problem? Versus adobo or sazon or monosodium glutamate or all of these concentrated salts that are not actually the same as like a rock salt that we would use in our diet. Yet they're put all into the same bubble. It's like somebody trying to say that like running 23 miles is the same as back squatting 400 pounds. Like absolutely have almost nothing to do with each other, except that you could say that they're both exercise. But other than that, like, I don't know, there's no connection there. And it's like salt is bad, but salt is actually one of the best things for us, again, in moderation, but it's looped in with all of those processed salts and all the salts that preserve our food and all of, those processed ones. So when it comes to salt, I'm not anti. I think if you're cooking with salt, I mean, who wants to eat vegetables that aren't salted beautifully, right? Like not me. I want sea salt on every single one of my vegetables or my meats or my pastas. That's very different than like the processed salt. So the other thing too is salt doesn't cause high blood pressure. Salt can exacerbate blood pressure in people who have high blood pressure. There's a very different line there. Salt increases the water in the volume of the blood. So imagine carrying a bucket that was 5 pounds versus a bucket that's 10 pounds. Obviously, there's more exertion on the one that's heavier. When you have more salt in the body, it pulls more water in, and therefore the thickness, if you will, of the blood and what the heart has to pump is greater, and therefore there's more pressure to pump it. People who have salt sensitive high blood pressure have to be very careful here. But salt doesn't cause high blood pressure. It's people who have high blood pressure can react to salt. We screwed that up in the world of telling and helping people understand salt. Of course, someone could say
hugely important. Yeah.
Yeah, and someone might say, well, what about, if you're dehydrated? Like, I'm not talking about all those like random situations, but salt, healthy salt in a diet is not, for me, a downside. There's nothing wrong with that.
Thank you so much. Again, Chad,
I made both of you. Chad gets his beer, you get your salt.
There you go.
This is a great day for all of us.
You're going to send those doctor's notes when we're done, right? So
Absolutely.
Dave can present that to Sadie later on and say, hey, we need salt in our food.
That's right.
And I can present it. Love it.
I love it. So coming close to the end, but I wanted to mention something you've been posting recently, this 12 days of wellness that you have going on. Can you tell us a little bit about what you're doing with it?
It was more, if I'm being completely transparent, it's sometimes hard for me to think about things to post because I just run out of ideas. And so the 12 days of wellness was sort of an opportunity for me to be like, oh, well, I can revisit 12 things I've already talked about because it's sort of the end of the year and I get to highlight them. So that's the not exciting reason for the 12 days of wellness. And I've worked with some really cool people and had an opportunity to learn some cool things that I thought, why not reiterate them, right? Like, why not sort of highlight them? In social media has been an interesting journey for me because I'm sort of learning that there's information that people want, but they also want to know that it's coming from somebody who's relatable and it's coming from a person and not, it's being put out there with a good intention. So my goal is to continue to build it, not from, you can find information on the internet anywhere. My goal is to sort of say, like, these are things that like I actually believe as a practitioner, as a mom, as an athlete, as a human who wants to be healthy and well. They're the things that are important to me. And if we all look for sort of a commonality, right? I know that my demographic is people who are interested in fitness, so I think we can find similarities and likes there, and that is important to me. It speaks a language that supports what other people are looking for. So that's where it came from.
And one of your most recent ones was Peloton, and I know you're very close with Rebecca Kennedy, who we had on the podcast last week, and we actually brought your name up because you guys are close, but how has Peloton become a part of your fitness journey? It seems like it's become more and more of a part of your what you do on a regular basis. Is that true?
Yeah, I mean, I did last night. I got to do a live with RK with Rebecca Kennedy, and we really focused on body dysmorphia and body image and all of that because it's so prevalent in fitness, right? This idea that like you're not fit if you don't have abs is the most ridiculous thing ever, but yet that's what people assimilate with being fit and fitness. And so we tried to just talk through some of these crazy ideas and misconceptions and the idea that, women more than men are rewarded for how they look and how aesthetically how they look sort of from a lean or fit. So we got to focus on that last night because it's so prevalent. But my journey with Peloton, you know, I've gotten to work with them. Fit Lab got to create classes with them, which was really cool. We got to do some testing, and I work with many or most of the instructors because they too have really important fitness needs based on like their diet, right? Like they're working out all the time, teaching, and they're constantly there. So they need somebody to turn around and say, am I eating enough? Am I eating the right things? What vitamins should I be taking? So I've been really blessed to work with many of the Peloton instructors to help them in their nutrition journey. For myself, it's a lot of, it's especially in the pandemic, it's convenience, right? Like there's something, I used to go to studios in New York City because it's nice to be able to just show up and do something and not have to think about it. And it's the new age version of that, to be able to jump on a treadmill and not think about how long I have to work, but to have Rebecca be like, okay, 3 minutes at this speed. For me, it's convenience, it's connection. It's been fantastic. And then of course Rebecca and I are doing our 12 days of handstands. And you know, I might do a lot of Peloton from the cardio side, but my love is still in gymnastics. So I'm always, you know, finishing with my hollow body rocks or handstands because it's the connection to what feels fit for me.
Love that. And of course, doing the handstands, Isaiah, your husband, is also a huge fan of handstands, and he's been kicking ass with them. And we have not seen you at a Power Monkey camp for over a year now with everything
devastating
going on, which is
it's been almost 2 years, I think.
Yeah. I know. Can we fast forward and get to the spring camp already? Because I'm ready.
If all goes well, spring, May 2nd through the 8th, we'll have our next camp, and then you're still on the docket to come to Greece with us.
I can't wait for that.
Which should be another amazing trip. But I am very much looking forward to when we're in person and me, you, and Isaiah can all be doing handstands together.
Oh, I know. Me too. Me too. And you guys
I'll
just
be over there. I'll be over there drinking my beer.
Chad will be drinking his beers, yes, while we're doing that, and squatting 500 pounds. And we launched our Power Monkey camp online. It's for pre-launch right now. Put a lot of time into it. It's will be officially available for purchase probably when this podcast comes out. January 1st was the official launch date. So I highly recommend people checking it out. It's certified with CrossFit and NASM and AFAA, and get your units, and it's 23 hours of content from camp. Basically the next best thing to actually being there in person with us.
Oh my gosh, I can't wait. Yeah, Rebecca and I literally opened up our live last night talking about how awesome Power Monkey Camp is. Because it's just adult fitness camp.
Spot. Yeah, it's a pretty amazing spot. And it's unfortunate that we had only one last year and that it was a little bit smaller than normal, but we're hoping that 2021 starts to kick it back into gear again.
I think we've all been faced with a lot of unfortunate needs to pivot in 2020. So looking forward.
So as we come to the end here, I already know your answer, and I think we got it last time, so we don't need to ask it again in terms of weightlifting gymnastics. We don't need to embarrass Chad.
No.
But with regards to potential additional guests, anybody that you think we should have on the podcast that you've come in contact with recently that would be a good fit for us?
Yeah, this is so crazy. I have no affiliation to this. I make no money. This is not anything that I'm connected to at all. So I'm purely just talking about from something that like is incredible. But I recently, I don't know, I've posted about it a lot, this ozone therapy water bottle that I have in the house. I'm going to tell you guys a really funny story. I don't know if it's funny to everybody else, but it's funny to me. I would always get so mad at Isaiah because his sneakers would smell so bad. Like sweaty sneakers. And then I got this ozone water bottle and sprayed them and they've never smelled again. Anyway, it's this bottle and you put water in it and it kills COVID, it kills bacteria, it kills everything. The point of it is that this company came out with ozone and it's safe on fitness equipment and you can use it on everything. I spray my kids' backpacks. I don't work for the company. I have no affiliation. I'm not making any money. But I think it's really cool that we're able to start looking at ways of cleaning that doesn't involve such harsh chemicals and sanitizers, because I think in 2 years, my company, as in like the private practice, is going to be dealing with an unprecedented amount of people who have gut issues because we are all destroying ourselves with hand sanitizers. And that's me too, every day, everywhere I go, because I'm like, COVID. But anyway, this idea that we are now starting to look at things like ozone therapy for immune function and ozone therapy with water to address. So I don't know if you guys will ever actually bring them on, but it's really pretty cool to hear the technology behind being able to kill viruses with a natural way to do it. And that's just sort of a love of mine.
Amazing. I will definitely check them out. What is it? Ozone what?
It's just called O3 Waterworks is the company.
Okay.
And they're just looking at like, what does it mean when we stop using chemicals?
Mhm.
So I don't know. I mean, that's just something that I've found really interesting. And then I don't know if you guys have ever done this. The other thing I really promote a lot is, have you ever brought a therapist on your show?
I don't think we have. I don't think so.
I think
Just
that
some sports psychologists and stuff like that, but no.
I think
no therapists.
therapy is really interesting because there's a stigma around it, right?
Mhm.
But like, it's also such an incredible tool for people, like even just the things that we were talking about. How do you break up with sugar? Why do you need it? Right. So I send everybody therapy. I'm like, you need to go to therapy and sort of learn about yourself. So I think it's really cool to talk to a therapist about different concepts that they see in fitness and stress management and alcohol. It's always a cool conversation. We get to learn about ourselves more.
Love it.
That'd be my two.
Thank you so much.
Those are two incredible recommendations.
Miss you too.
Yeah. Well, we do have a few more things here before we let you go. And one, we may have asked this last time, but is there anything that any books or movies or documentaries or TV series that you've come across here recently that you'd recommend?
If you're a female listening, the book Untamed by Glennon Doyle was one of the best books I've ever read. If you're a male listening, sorry guys.
You got nothing for us, right?
I mean, you can read it, but it's not gonna wow you. But it's an incredible story of being a woman in this day and age. And so I've yet to meet a single woman who has not read that book and been like, unbelievable. So that would be what I've recently read. Haven't watched anything. I mean, we've been watching a lot of like Netflix stuff that I wouldn't like documentaries, but they're not about fitness or health. Like think The Vow and things like that. Yeah. The only thing that comes to mind right now is Untamed because it was so incredible.
Yeah. I'm looking at it now. I think it might be a stocking stuffer for Sadie.
Oh my God, for Sadie, it would be. It's so perfect timing too because you guys just had a second baby. Like it's really, really good.
All right. Thank you.
Really good.
Another thing.
You've got me curious enough. I might have to read it myself. I don't know. I know you said guys don't need to read it, but I'm very curious. I'm sure it could be helpful in some way.
I mean, I've read a lot of books. I'm a reader. I've read a lot of books. This is maybe in my top 3 most favorite books I've ever read.
Nice.
All right.
Wow.
Excellent.
Very cool. Well, as always, it's a pleasure to talk to you. Good to see you. Hopefully get to do that in person, as we've all said here in the very near future. But before we end here, do you have anything coming up you want folks to know about? Any parting words?
Well, I'm not going anywhere, and I don't have anything coming up because of our lovely pandemic. But no, I mean, I think stay connected on Instagram. That seems to be the way that I'm speaking these days, right? Doing just different lives and different podcasts. And so that's it. Connect, hang out via social media.
Absolutely. Well, we'll certainly keep up with you. And to our listeners out there, guys, as always, be sure to head over to powermonkeyfitness.com for services and upcoming events. Also, check us out on Instagram for regular teaching and technical content at Power Monkey Fitness, at Dave Durante, and at Ollie Chad. And on behalf of Power Monkey Fitness, we're your host. I'm Chad Vaughn with Dave Durante. And until next time, guys, thank you all for listening.